Hello, everyone. My name is Kathleen Helgeson, and I'm the coordinator of the Patient and Family Resource Center. I will be helping moderate a couple of the breakout sessions today. It's my pleasure to introduce Ian Scott. Ian is a psychosocial clinician who provides counseling here at CancerCare, and today he is going to be presenting on the topic, Who Am I After Cancer Treatment? Welcome, Ian. Thanks for joining us today.
Thank you, Kathleen. Thanks for having me.
I'm going to pop off the screen and let you take over, and we'll see you at the end of your session.
Yeah, wonderful. Thank you. I hope everyone's having a good day at the conference so far. I'm going to be sharing a PowerPoint today, but before I do that, I just wanted to thank everyone for making time to come to the presentation today. And I'm going to be presenting, as Kathleen was talking about, who am I after cancer treatment? And so that can look a whole bunch of different ways for different folks. And I know we've got patients in the audience, also family members and supporters of those patients. So I'm hoping that you can get something out of the presentation today as we go along. And yes, we will have some time at the end for Q&A. Okay, so let me just pull up the presentation and begin the slideshow mode here. Okay, so I work at CancerCare. I'm a psychosocial oncology clinician there at CancerCare Manitoba in patient and family support services. So today, what is it that we're going to try to get into? But first, actually, before I get to the goals of the presentation, I do want to just review this equity commitment, which you may have already seen in other presentations. Thinking about health equity and how different obstacles and barriers can be mitigated or prevented to improve health outcomes for different populations is very important to consider. And I have considered this in preparing this presentation today. Okay, so what are the topics for today? We're going to be talking about why this topic was brought up as a potential presentation for this conference in the first place. It is so commonly cited by patients and families about how the time after treatment is complete is much harder than people expect, and often people are blindsided by it to a degree. And we're going to talk about some of the common challenges in that post-treatment phase that people encounter, and we'll also look at what can be done about it, what might be able to help some of the struggles that you might be going through or you might be anticipating, depending on where you're at in your own trajectory with cancer. I will also say, too, that I want to recognize that some cancers require ongoing treatment. Some cancers are considered incurable or chronic. But I do think a lot of what's going to be in this presentation today will still apply. So I think you'll get something out of it as well, too. So, why is this part so hard? Well, I think the question that you see on the screen there might capture it in a nutshell. People are often wondering whether or not they'll be their old self again or they'll get their old life back. And sometimes, as a diagnosis, the news of a diagnosis first sets in, there's often a desire to just sort of put your head down, get through it as best you can, hope that the treatment works, and then get back into the old swing of things. But as time progresses, and I'm sure I'm speaking to many people who've lived this experience by now, that sense of being exactly who you were before cancer treatment is not necessarily attainable or attainable at all, frankly. Things change, right? It's a life modifying, life altering experience to be diagnosed with cancer of any type, of any stage of cancer. And so that sense of going back to your old self starts to fade, and then you start to figure out what parts of myself do I still feel like I can get back into? What are the parts of myself that I would really like to regain or retain in my life? And then what are some changes that I feel like I might be adapting to over time? So this sense of loss is actually its own form of grief, this sense of identity that you can be grieving. And it's not often a recognized form of grief when people are going through cancer. Um, and so some of those illusions of who you are now are certainly shattered as a result of this kind of experience in your life. Another reason why this period after cancer treatment or any sort of amount of time that's passed since your time of diagnosis is that often our supporters, our family members, and I know some of you might be in the audience today, might be really keen to celebrate when treatment ends. You know, I've spoken to lots of patients in my time counseling them that end of treatment celebrations are unplanned or, party at the end of the last radiation treatment or the last chemo treatment or what have you, right? Or if you get positive scan results, if you're fortunate to get a result that says there's no evidence of disease or there's news from the doctor that the cancer is in remission, then often the people around us really want to celebrate. And as a patient, you might really want to celebrate too and recognize that. And that's totally fine. But I do often hear that people are actually finding that that news is sometimes more anticlimactic than they initially anticipated it would be, because their brain almost faster than they would ever anticipate transfers to, well, what now? Like, what's the follow up? How do I know it's gone? And almost ready to go into sort of a fear of, is the cancer coming back mindset very, very quickly, much faster than they ever would have thought, right? And then they really start to transition to a totally different mindset. It's a completely different phase of treatment, the post treatment phase. We kind of have our pre treatment phase where there's a diagnosis workup, and sometimes you're waiting to find out if something is cancer or not, which is its own anxiety provoking phase that people go through. Then there's the treatment phase, usually, where people often under incredible physical duress and dealing with side effects from treatment and things like that, but then sometimes once you get to the post-treatment phase, there's still physical impacts going on, but the psychological and emotional impact of cancer really starts to expand and it really starts to hit home. And so that's often a major shift that people don't always see coming. But speaking of those ongoing physical effects that people can have post-treatment, those are some of the things that make this such a challenging time in the trajectory of people's cancer experience. So these could be physical side effects, like I mentioned, but they do include mental, emotional, and spiritual effects as well too. I want to make special mention of some of the most common ones that people have. Uh, a lot of times, people feel some brain fog or some struggle with cognitive ability, where sometimes their thoughts feel a little bit blurry. They have trouble retaining information, or they feel like a word's on the tip of the tongue, but it doesn't come to them. It's an extremely common impact side effect of cancer treatment, and doing memory skills and learning different task management strategies can help, and there are resources available for that. But it is a very, very, very common side effect in cancer. Um, and another one that's very common that I'll make special mention of is fatigue. I really wish the general public would understand how fatigue for people with cancer is a different type of fatigue than someone who's never had cancer experiences. It's the kind of fatigue where you can have a 3 hour nap, wake up, and feel more tired than you did before you went to sleep. Um, and fatigue, right? Like sometimes we can tell when someone is tired, I guess, by looking at them. But in many respects, there's kind of an invisible nature, kind of an ephemeral quality to fatigue. And there's also this assumption, I think, in the medical field that with time that will improve on its own. And while that may be true, it can last a lot longer than people have the patience for, quite honestly, for how long fatigue can last. And it affects people's ability to get back into, work and school activities or family activities, what have you, right? And sometimes there's not always a clear understanding of what can or should be done about it. Um, and so sometimes fatigue kind of gets shunted off to the side as an ongoing side effect when something like pain might be more readily um, as- easy to assess for medical professionals. Not to say that pain is always easy to get on top of, but it's almost got like more different interventions and medications that the doctors know about, but there's very little that they know that they can do about fatigue. So that's a frustrating point for many folks, and I'm sure many people in the audience as well too. I hope that resonates with folks. So I mentioned brain fog, I mentioned fatigue. Those are two of the top three patient concerns that come up in the post-treatment phase. And I wonder if people can just bring to mind. I can't see the chat box, but if people want to bring to mind what the third most common concern is for patients after treatment, it is fear of recurrence. So that probably comes as little surprise to most people. Um, but it's a very destabilizing experience to feel uncertain of whether or not the cancer is gone. Um, or if you know that the cancer's still there, whether it will progress or get worse. It's the same kind of idea. Um, and then there's always this period of time for many folks where like every ache and pain can feel like it might be recurrence. You can feel like you're living scan to scan. That it's harder to plan your life in more than 3 block increments. For example, if your CT scans, let's say, or your MRIs are every 3 months. So it says on the screen there, name it to tame it. So basically, this is one strategy for dealing with it. Acknowledging that you're fearing the cancer is coming back in some ways can actually tame the intensity of that emotion rather than just trying to distract yourself and block it out entirely. I don't downplay the value of distraction and occupying yourself with other things, but that cannot be your only tool in the toolbox in order to deal with intense fear of recurrence. And just being aware of the things that you do find most upsetting, like maybe it is coming to cancer care. Surprise, surprise, a lot of people don't. A lot of people get pretty sick of coming to the cancer care building, given how many times people have to visit there. Sometimes anniversaries or milestones or dates in the calendar that remind people of the time of their diagnosis. Let's say, like if someone gets diagnosed in the spring, sometimes that bodily emotion and memory comes back at that same time of year, year after year. Sometimes learning about someone else's diagnosis or just seeing things in the media, all of a sudden every TV show you watch on Netflix or Disney Plus or whatever has a character in it who's dealing with cancer. And even some sights and smells can actually get people going on this. So I would just say if you're struggling with fear of recurrence, acknowledge the fact that this is a relatively common experience. Um, know that it will gradually decrease over time, but also just look at what you know. You know that you completed your treatment. You know you did your best to follow the treatment regimen as directed. You know that there are people, whether it be the cancer care team or your family doctor, watching for signs of recurrence, right? If there is a persistent physical symptom, you can try to look for the cause of it. Like, well, did I go to the gym? Did I work out? Did I bang it on, a table or something? But if it does persist or get worse, then you're always welcome to reach out and ask for help around that. So those are the things that we can do. Fear of recurrence, it's basically it's a manifestation of anxiety, right? So a lot of the things that we would normally do to cope when we're feeling anxious will work and help when we're feeling fear of recurrence. So it's useful to think about it in those terms as well. Okay, so I did make brief reference to this earlier, but another challenge that comes in this post-treatment phase after cancer treatment is returning to work or school. So sometimes we're in different financial circumstances. Sometimes we're having to look for different work. Sometimes we're dealing with relationships at work of who knows and who doesn't know. There's a wide array of like levels of understanding that people will find from like a supervisor at work. There's specific challenges involved if you are a contractor or you are self-employed. All of these kind of things can mitigate or affect your ability to return to work or your daily activities and whether you're going to school or whatever it may be. And I do have on the screen there a really good resource to review, cancerandwork.ca. One point I will make, though, that I find to be very helpful for a lot of people after cancer treatment, if you are going back to work, think about your return to work as part of your recovery. It's not something that you do when you're 100% ready to go, because if we waited for that to happen, then you would never get back there, right? This is why gradual returns to work exist, where you slowly ramp up your hours. You're not expected to be fully there or fully over brain fog or fully over fatigue or fully over fear of recurrence when you get back to work. That's just not reasonable. So that's why we do these gradual returns to work, right? So that's something I think that can be useful as a framework for thinking about this. Another challenge that's very common for people in this phase after cancer treatment is how your social life can change. And sometimes your social life changes almost immediately at the time of diagnosis, right? And, you know, the, hearing that a friend or family member has cancer can do really strange things to people's minds. And sometimes it can really surprise you and hurt you as a patient based on how people either rally to your side and support you appropriately or don't, right? And some people sort of disappear or distance themselves for whatever reason. Maybe they can't handle the emotional impact of that, or maybe they don't know what to say. The end result is that it can be quite hurtful and quite surprising. And then sometimes people step up in a real way and you find out that they, who your real friends are, to use a cliche, and it can surprise you to who is really there for you throughout that time, right? And then you got this whole roster of people sometimes where people will say, well, call me if you need anything, or that sounds really hard. But it's very hard as a patient to then pick up the phone and say, well, you said I could call if I needed something. So for the family members and supporters out there, just thinking really in concrete terms of saying, like, I'm going to bring you a meal on this day at this time, or I'm going to take your kid to swimming class for you so you don't have to, or something very concrete, and then seeing if the patient identifies that as a useful thing that you can do to help them in their life. It's a very good approach. Be a little bit more concrete with your offers of help. Okay. So this was the third goal. We have about 5 minutes left in our presentation. And this was the third goal of the presentation today. So we've talked about some of the common challenges in the post-treatment phase, but what actually might help? So this is obviously going to be different from individual to individual. So whether that's coming for counseling, whether that is joining one of our support groups or educational groups, uh, whether it's some other form of self-care activity like journaling or getting back into, exercise to what your body can tolerate, just thinking about what it is in your life that you want on your plate. And you can actually go back to before the cancer diagnosis and say, well, these are the things I really don't want to lose about myself. But maybe there are some things that have sort of shifted in terms of what your priorities are, what you feel is important, what you feel is complaint worthy. And then some of those things you're going to take off your plate because you can only have so much space on that plate, right? That we see on the screen there. So you can shed other people's expectations of how you should be living your life. You can also remember one very important thing. And this also ties back into that fear of recurrence piece I was talking about before. The reason people fear recurrence, when you really boil it down to this sounds like Captain Obvious, me saying this, is people have a desire to live. So they don't want the cancer to come back and they don't want to go through treatment again, right? Why do you do treatment in the first place? It's because you don't want to die, right? That's typically why people do treatment. So remembering that you went through all that can sometimes help motivate you, as scary as it can be, to sort of get going in your life again. Is that the reason you went through all of that was so that you have a life to live. So the best you can, putting one foot in front of the other, um, can help you as you move forward through this phase. And then also taking control of what you can, right? Being honest about your boundaries and your own expectations for yourself, speaking to yourself with kindness, self compassion, breaking things down into more manageable chunks so you don't get overwhelmed in day to day life, managing your energy levels, right? And just trying to remind yourself of the things that you do have control over, right? Because there can be such a sense of loss of control with the cancer diagnosis as we go here. So, coming to the end of this presentation before we get to Q&A, but I do just have a couple take-home messages to leave you with before I hand it back over to Kathleen to moderate the questions. Um, these are my main take-home messages today, right? So one is that the post-treatment phase is often the hardest from a psychological and social perspective for sure, and sometimes physical as well too. And we don't really do a great job at Cancer Care of telling people this when they're first diagnosed or starting out on treatment. But I think when you think about it, you can understand why, about how overwhelming diagnosis and treatment can be to then say, like, yeah, you're going to finish treatment. Hopefully, if it's successful, then you're going to have a big, long period of time where there's other struggles, right? It's just there's only so much that our human heart and human brain can tolerate. But knowing that this phase is coming can be helpful so you're not completely blindsided by it because it does take a long time. And then just being patient with yourself. figuring out whatever approach or mindset is going to work for you as you move forward after cancer treatment, or if you're continuing treatment, like what is going to make sense for you in your own life to help you cope with the day-to-day challenges that we talked about today. So I just have that reference list there, but I'm going to stop sharing my screen and then hand it over to Kathleen.
Thank you, Ian. Had a little trouble getting my camera on there. And thank you so much also just for affirming that these challenges that are so common are completely normal and realistic, and I think that's really important to hear. It's very validating. So we invite our viewers now to post any questions they may have for Ian. There's a couple questions that I would like to ask. It's a great question here about how do you adjust to repeated survivorship? So the idea of maybe going through a period of recovery or remission and followed by a relapse or reoccurrence, and just going through that kind of on an ongoing basis year after year. How do you adjust to that?
Yeah, so that's a very that's more common than people realize having to deal with that psychological component. And often on the at the for the first time around or first line treatment, there's this feeling of like, okay, if I can get through this one time, then maybe I can sort of adjust to this period of time and then the post treatment effects still come, but you feel like, okay, if I just go through this one post treatment phase, then I can then think about the remaining years I have left to live. But then if you start experiencing frequent relapses, it does become hard to sort of look past living with active cancer. So one suggestion that I have, and I don't know if this would work for the person asking the question, I've had some patients in this experience sort of just reframe it in their minds as if they're living with a chronic illness. So that doesn't mean that's a medical diagnosis based on your type of cancer, and there's certainly some types of cancer that are like labeled and considered chronic from like a biomedical perspective. But even just from like a psychological perspective for yourself, sometimes people have found it helpful to think about them living with a chronic illness because then it just makes a little bit of those ups and downs a little more easy to tolerate. So they're not trying to build up the hope of like, oh, the cancer's never coming back, but that they learn to live with it in a particular way that allows them to sort of to live more presently in the moment. That's not going to work for everybody, but I have had some patients use that to good effect. So it's something to consider.
So sort of seeing their condition as a chronic condition, and rather than having that roller coaster of if everything's good and then they're back to treatment again. So just with that expectation.
Right. Yeah. It
Mm.
removes some of the sort of yeah the expectation and anticipation. Right.
Mhm.
And it also there'll still be highs and lows obviously with relapses, but it sometimes makes the lows a little less low in that respect.
Mhm. There's a comment here, more of a comment than a question, uh, saying that there's those of us that feel anticlimactic to finally get the all clear because they've known inside for a long time that they are fine, and it takes everyone else time to catch up to us. So is that sometimes the case where people are feeling quite positive and then and they've sort of known for a while that they're going to be all right, and then other people are still treating them um, with some maybe a bit more apprehensive, a bit more tentative about celebrating. Is that also sometimes what happens?
Yeah, that does happen. And also that we talk so much about fear of recurrence, and I was really talking about it through a patient lens, but often supporters and family members experience much more intense fear of recurrence than the patient themselves.
Mhm.
Um, and sometimes when you feel like you know that the treatment that you've had has clearly made you feel better, or there's like a lump you used to be able to feel that you can't feel anymore, or whatever the case may be, um, it it can feel anticlimactic in yourself, and other people are sort of waiting on bated breath. Um,
Mhm.
but that is another form of anticlimax that Michelle mentions there. That
Mhm.
that people kind of expect you sometimes to be struggling more than you are, which is a whole nother
Mhm.
type of frustration that can happen post-treatment. And then you're
Yes.
sometimes thrust into this like emotional caregiver role for the people around you, which is not really your role to adopt. And
Mhm.
some people just you have the right to reject that role, but some people feel thrust into that role because people are saying, "Oh, I'm really struggling," and it's not. They're saying that to the person who has the diagnosis. There's this model of concentric circles. Like if you think of circles getting wider and wider as we go out, that when we're thinking about how we support or who we get support from, if the person with cancer is at the center, right, they're the one with the diagnosis, all support should be coming in. So on that first circle around that patient is the immediate loved ones and family members. That support goes inwards. And those family members can support laterally on that circle that's right around the patient. And on the next one out, it's maybe more distant relatives or friends or acquaintances. And they can support each other, but they should not be looking inwards to the immediate family or the patient to get their emotional support. They can get support from each other or from someone on an outer circle. So you get your support from outer circles and you support inwards when you're
Inwardly.
trying to
Yeah.
offer support. Yeah.
Mhm. Another, a good question about you mentioned about fatigue and that being one of the main challenges that people experience. How do you explain to people that your cancer-related fatigue is different from just general fatigue?
Yeah. So I think even just describing how like restorative sleep is not restorative often after people are dealing with cancer related fatigue. Explaining that it's one of the most common cancer side effects might work on some people, but again, some people will have blank stares to that kind of definition. I think one of the most useful things I've ever seen is that they've done these like functional MRI scans on people with cancer and people not with cancer, and they'll do like sort of like a mental math test, let's say, and they'll ask the same questions, and the person with cancer who's under an MRI machine using their brain will get all the right answers, and the person who doesn't have cancer also gets all the right answers. But then if you look at the MRI scan, the person with cancer's brain MRI scan is like lit up because their brain is working overtime to get to those answers. And that stands to
Mhm,
reason if your brain is working harder than someone without cancer has to work to get to the same answers,
mhm,
then you're going to be more tired. And so it explains that even though I might present as like I normally would pre-cancer, I'm having to work so much harder up here just to like get through my day and like remember to, get through my daily activities. Then I'm going to be way more tired because I'm overexerting myself to do what you don't have to hardly exert any energy to complete. Right. So that's one way to
mhm.
explain it.
And somebody else had made a comment about the fear of about brain fog. So brain fog and cancer fatigue are very interconnected, I assume. If the brain is having to work that much harder.
Yeah, absolutely. Yeah, so what I just talked about there is a very good example of brain fog. It's just like, see, I might seem like everything is fine, but the fogginess in my brain is requiring my brain to work overtime to get to certain answers. Um, and with brain fog, they like the cognitive rehab, which can be even just doing like little like puzzles or mind stuff can actually improve like crosswords or whatever it is, even though if you're not able to do those puzzles like you once could, do help. And there's a brain fog course that we refer to at CancerCare to Wellspring. Wellspring is a cancer support agency in Alberta and Ontario. And if you just look at Wellspring well on the web, they have a ton of free online courses actually that you can browse. And there is one on there about brain fog. It's an 8-week course. It's an evidence-based course that teaches you memory skills, task management skills, psychological well-being skills, and I highly recommend it if you're experiencing brain fog and just getting on the wait list. It's not a super long wait list at Wellspring,
Mhm.
and taking that course is useful.
Maybe we have time just for one quick question. Is there any quick tip that you can offer? Because we're at the end of our session, how to deal with family who are just really worn down from being supportive, like so that maybe they just don't have it in them to continue to be supportive. Is there a strategy or any advice in terms of how to deal with family members that are just burnt out?
Encourage them to get support. Like, it's a lot actually to just add one more thing seemingly to their
Mhm.
calendar sometimes, but whether that be virtual counseling, which is a little less cumbersome than going somewhere for an in-person appointment or joining our caregiver support group. Sometimes people just won't necessarily bite on those offers of support, but continuing to encourage that is useful.
Mm. Thank you so much, Ian, and thank you to all our viewers who offered some great questions for discussion. Thank you again, Ian, and take care, everyone.